Hello there, and welcome everybody to your clinicals, your first clinical. You're going into the hospital. How exciting! Nursing 6970. Excuse my cat in the background. One of two that tends to roam around as soon as I turn the camera on. So I thought, well, I'm just going to leave it. So, anyways, my name is Dr. Jenny Peters. I don't think that you know me at this point, but I may be your instructor for another course for 6201. I'm not sure. Anyways, welcome. You can call me Jenny. My role is the clinical course coordinator for this course. So what does that mean? Think of me as I am the top of the umbrella, overseeing all of your clinical sections, making sure that everything's going well for you at the site with your instructor. Make sure the course is set up correctly in Canvas. Make sure all the assignments are ready to go. I'm here to be your advocate. I'm here to be there for you whenever you need me. With that being said, you're going to be assigned a clinical instructor. There's about 8 students in each section, and you are assigned to a clinical instructor, and you go out to your hospital that you have been assigned to. So your instructor is going to be the one that is your instructor for the Canvas course, telling you when assignments are due, going over expectations. She's running the course. But think of me as the course lead who's like overseeing everything, because I want to make sure that everything's running smoothly. And especially because we have COVID, there's a lot of different things that we have to juggle. Sometimes we've had to switch floors. Sometimes we've had to not be in the hospital and they kick us out. But that's not going to happen this semester. And we're going to think very positive, and it's going to be awesome. So you took a fundamentals course, you took patho, you took pharm. So I know that you are familiar at least with things. So there's just a few things that I want to go over. Actually, let me finish up my course coordinator role. So if you have any issues, go to your instructor. Talk to your instructor. If you feel like this is like you're having issues with your instructor, then you can come to me. That's totally fine, because again, I'm your advocate and I want to make sure you're successful in the course. Other than that, think of your instructor. That's your instructor. You go to her for anything. And really what I'm going to be available for is the instructors. Like, say you ask the instructor something, they're not sure, and then they can come to me and ask me. So I'm kind of like the liaison here. So with that being said, if you are ill, you have to do the COVID. There's going to be some COVID information being sent out to you. At the time that I'm recording this, things may change with the CDC, with the different hospital sites. So please stay tuned for that. But basically, if you are ill, you need to let your instructor and myself know right away. So it's easy just to put an email and CC me on it. And that way I know, because I keep I'm keeping track of who's absent for the semester. And there's an absence form to be filled out. You don't get docked points for missing, for being ill. It happens. But we recommend not being ill, not taking off for anything else. Obviously, if it's an emergency, emergencies happen. I totally understand that. So with this, you're going to see 4 different things. I send these out ahead of time for those who, and a lot of us like to know, be in the know and plan ahead, because I know that we all have lives and we're trying to plan. And when you're in school, you have a lot of stuff that you have to juggle. So I sent you the syllabus and your sim schedule. Your sim schedule, you will be with either Dr. Thompson or Professor John Uchik. And I think he's doing 2 sections. But anyways, there's the sim schedule. You meet every other week through the semester for simulation. There's also a couple things that you need to do to be prepared for clinicals. There's a medication card assignment. It's not as extensive as your med card teaching that you did in pharmacology, but read the instructions. It's very self-explanatory, but you can use a 3x5 or 4x6. Most people do 4x6s because you have a little more room. And you have a list of common drugs. And so you're going to write down on each card that drug. Those are the most common drugs that are prescribed by the provider. And you're going to gather those together, and you're going to bring them on your first day of clinical and hand them into your instructor. Your instructor is going to look over them, make sure they're A-okay, and that's about it on that. So go through your syllabus, your sim schedule, your med card assignment. You should be receiving an email from your clinical instructor about 1 to 2 weeks prior. So I kind of stay on the instructor, say make sure you email. Now remember, they don't attend orientation until mid-January. So they don't get the orientation, although I do start communication with them early like I am with you. So maybe they'll get stuff out to you earlier. But there's some behind the scenes things that they need to get prepared, like get a hold of the unit manager and make sure everything's A-okay for that unit. Are there any restrictions? Can you pass all medications? Etc. The other thing I wanted to talk to you, I will be meeting with you as a group though for more orientation about the hospital. So I don't want to go over 10 minutes on this. It's enough. Our attention spans are what, 6 seconds? At least mine is. So anyways, first time in the hospital, maybe some of you it's not. Maybe you have a degree in something where you work in the hospital, you have some experience. Maybe you're working as, I don't know, CNA or which you very well could be. But then some of you are not, and that's okay. That's totally fine. For those of you that are not and don't have any past experience, say you have students that are experienced, it's okay. You're going to progress. Sometimes it may seem like the ones that have experience are more comfortable because they will be, and you're not in the beginning. Don't try not to feel inferior. It does not matter. You're still going to end up in the same place where all of you are learning the nursing process. All of you are learning to think like a nurse. And the one thing is, I know all of you love skills. I love skills. Remember, nursing used to be a skills profession. Actually, it used to be the doctor saying, "Can you get me my coffee?" It was still like that in 1994. It was crazy. So anyways, what was I saying? Losing my track. So it's now not a skills profession. Yes, you will do skills. And if you don't get to do that skill, even during your whole accelerated program, when you get a job, you're going to learn the skill because you guys are very smart and you can pick up a skill easily. All right. So keep that in mind. Nursing is a knowledge profession. So this is where you're going to learn all your knowledge, how to critical think. If you get a patient that has, say, had an MI, a heart attack, has hypertension, has hypothyroidism, hyperlipidemia, how are you going to put all those together? And what is what needs does this patient, what are the needs that this patient has that's in the hospital? The why are they in here for this? Why are they in here for that? What are we going to do about this? What are we going to do about that? It's putting the whole picture together. And that is what's important. When you get out to practice as a nurse, the other nurses are not going to teach you that kind of thing. This is the stuff you're learning now. Yes, you're going to learn so much more when you get out. That's just what the nature of the beast with education. You get out, you're a beginner nurse, and through years you're going to gather experience, and it's going to be awesome. So this is why in Canvas, your materials that you bring to clinical each week are very intentionally made and for a reason. It may seem like there's paperwork. I did end up taking assignments out for this semester and trying to make it a little bit more feasible for you because this is your first time. I want you to get used to prepping for patients. I want you to get used to going in and saying hi to a patient, doing AM cares. So you will be having some reflections. You'll have 6 of them to do through the semester. And that is not APA. We have nothing APA in this course at all. I want you to reflect and write what you want. And then there's 2 nursing care plans, which the template is set out for you. So that's basically it. Other than your med cards, you're going to be doing patient care every week. Now, your instructor will want you to hand in the prep sheet either the next week or at the end of the day to give you feedback on how you're prepping on your patient. Because in the beginning, we're learning to do it. And as time goes on, you may be doing great and your instructor may say, you know what, I don't need to see this anymore. Then you come in and you prep for your patient. It will be expected that you come about an hour early to clinical because you'll need that time to prep on the patient, meaning you'll get your assignment. You will need to look in the computer at stuff to find out more information about your patient and get shift to report. And I think that's about it. Epic training or whatever hospital computer you're on. Mostly it's Epic now, but stay tuned for that. Sometimes you have it on the first day of clinical, sometimes it's on a different day. So stay tuned. Your instructor will contact you about that information. In the meantime, I did go over 10 minutes. I'm sorry about that, but I kind of wanted to give you a rundown of what's going on, and I've attached some stuff for you so you can just take a look at it, wrap your head around it. You don't need to know this stuff now. The only thing you need to prepare for is the MedCard assignment, and just get to know your clinical schedule, sim schedule, and your syllabus, and wait for your instructor to contact you the week before. I will be sending out one more email with when we're going to meet for orientation. That's a great time to bring all your questions to me. All right, so have a nice relaxing break. You guys made it through a tough semester, and so I hope you enjoy clinicals. Take care.